1. Which of the following measures is used to estimate the burden of disease in a population? A. Odds ratio. B. Incidence rate. C. Disability-adjusted life year daily. D. Case fatality rate. 2. In a cohort study, relative risk is used to A. Measure association between exposure and outcome. B. Determine prevalence. C. Identify confounders. D. Establish a case definition. 3. An outbreak with a sharp increase and decline in the number of cases is best described as A. Continuous source outbreak. B. Propagated outbreak. C. Point source outbreak. D. Mixed outbreak. 4. The ability of a test to correctly identify those with the disease is A. Specificity. B. Sensitivity. C. Predictive value positive. D. Predictive value negative. 5. Confounding can be minimized in a study designed by A. Randomization. B. Matching. C. Restriction. D. All of the above. 6. Which statistical test is most appropriate for comparing the means of 3 or more independent groups? A. T-test. B. Chi-square test. C. ANOVA. D. Regression analysis. 7. The p-value indicates A. The probability that the null hypothesis is true. B. The probability of observing the results given the null hypothesis is true. C. The confidence interval. D. The size of the effect. 8. In a normal distribution, approximately what percentage of values fall within 2 standard deviations of the mean? A. 68%. B. 95%. C. 99%. D. 100%. 9. A type 1 error occurs when A. A true null hypothesis is rejected. B. A false null hypothesis is not rejected. C. The study power is low. D. The sample size is too large. 10. Multicollinearity in regression analysis refers to A. High correlation between independent and dependent variables. B. High correlation between 2 or more independent variables. C. Errors in data entry. D. Sampling bias. 11. The term bioaccumulation refers to A. The increase in toxin concentration as it moves up the food chain. B. The gradual buildup of chemicals in an individual organism. C. The spread of pollutants in the air. D. Degradation of toxins in soil. 12. Which of the following air pollutants is most associated with respiratory diseases like asthma? A. Carbon monoxide. B. Sulfur dioxide. C. Nitrogen. D. Ozone. 13. The Clean Water Act primarily regulates A. Air emissions from factories. B. Hazardous waste disposal. C. Discharges of pollutants into U.S. waters. D. Use of pesticides in agriculture. 14. Radon is a health hazard primarily because it A. Causes skin burns. B. Is highly flammable. C. Emits ionizing radiation. D. Reacts with water. 15. Noise pollution is measured in A. Hertz. B. Joules. C. Decibels. D. Watts. 16. The Beveridge model of healthcare financing is primarily A. Insurance-based. B. employer-funded. C, government-funded and delivered. D, privately managed. 17. The primary goal of health economics is to A. Maximize hospital revenue. B. Minimize insurance premiums. C. Allocate scarce health resources efficiently. D. Reduce taxes. 18. An HMO health maintenance organization is a government-run insurance plan. B. A plan that provides healthcare through a network of providers. C. A private hospital. D. A pharmaceutical company. 19. The Affordable Care Act ACA was designed to A. Eliminate private insurance. B. Expand Medicaid and health coverage. C. Reduce the number of doctors. D. Increase drug prices. 20. A SWOT analysis evaluates A. Clinical trial results. B. Policy outcomes. C. Strengths, weaknesses, opportunities, and threats. D. Systematic reviews. 21. The health belief model suggests that behavior change is influenced by A. Peer pressure. B. Perceived susceptibility and severity. C. Genetic factors. D. Availability of vaccines. 22. Which theory emphasizes the influence of personal, behavioral, and environmental factors on health behavior? A. Trans-theoretical model. B. Health belief model. C. Social cognitive theory. D. Theory of reasoned action. 23. Social determinants of health include all except A. Education. B. Income. C. Access to healthcare. D. Genetic mutations. 24. A key component of community-based participatory research is A. Focusing on clinical trials. B. Excluding local stakeholders. C. Engaging community members in all research phases. D. Using only quantitative data. 25. Health disparities are best addressed by A. Uniform healthcare policies. B. Targeted interventions for vulnerable groups. C. Eliminating private insurance. D. Increasing clinic hours. Master of Public Health. The Master of Public Health MPH test is a comprehensive assessment designed to evaluate a candidate's knowledge and competencies in core public health disciplines, typically required for graduate-level public health education and practice. It covers key areas such as epidemiology, biostatistics, environmental health, health policy and management, and social and behavioral sciences. The test measures critical thinking, analytical skills, and the ability to apply theoretical knowledge to real-world public health challenges. It is often used for academic admissions, professional certification, or career advancement in public health roles. The MPH test ensures that candidates are well prepared to contribute effectively to public health research, policy, and practice at local, national, and global levels. Here are the top 5 beneficial uses of the sample exam. 1. Graduate program admission. The MPH test serves as a standardized measure to assess readiness for admission into competitive public health graduate programs. 2. Career advancement. It validates a candidate's knowledge in core public health areas, supporting promotions or transitions into leadership roles in health departments, NGOs, and international health organizations. 3. Professional certification. The test helps professionals meet credentialing or licensing requirements in public health-related fields, enhancing credibility and job prospects. 4. Workforce readiness. The exam ensures that graduates possess the skills needed for evidence-based practice in diverse public health settings. 5. Public health policy impact. Success in the test supports individuals aiming to influence health policy, enabling data-driven decision-making and community health improvement.